Tell me, Rajiv, how is artificial intelligence is going to contribute to the growth of healthcare industry?
I think this question is floating, everywhere, and this discussion happens uh, even with uh, folks who doesn't understand tech, including my mom, who's 80 plus. So, artificial intelligence is no more artificial; it is the real intelligence. Okay. Now, we all know that worldwide there is a shortage of doctors across all areas, be it radiologists, lab doctors, physicians, surgeons, uh, and this got amplified during COVID. No nation could claim that they have enough beds, they have enough doctors. I'm not talking of 20 years back, it's just a 2 years old story.
Correct.
Now, think about, can we do something with the help of artificial intelligence to reduce the load of the doctors? I'll give you a live, practical, in production example. In production means it's already in use for. We run a CSR program called TB Free Haryana. It is run by our doctors, where a van goes to a van means a bus goes to a remote area where we TB is a poor people disease. So there, roughly in a one shift, roughly between 160 to 200 plus subjects come. I'm not calling them as a patient. They come for screening of the TB. The first line of diagnosis in TB is a chest X-ray. Why chest X-ray? For 3-4 reasons. A, it gives you the picture of the chest, including lungs. It's very easy to capture. You capture it in 30 seconds, less than 30 seconds, 20 seconds. It's non-invasive, which means you don't have to pick something. It's less cost. So with all these factors, chest X-ray is the first line of treatment. Now, doing all of these is easy, but who's going to read the chest X-ray?
Correct.
So you need a radiologist.
Correct.
So earlier we used to click a WhatsApp photograph, send it to the doctor. He used to tell, no, photo is not right. By the time all this permutation combination is going on, the subject has left the van because he's a daily wage laborer. He doesn't want to waste his daily wage, or he's a laborer in the farm. Now we realize that let's build an AI algorithm by which X-ray will go to the X-ray in a DICOM form, which is a soft copy in a predefined format. It's a format. It goes to the cloud, image will come, and will tell that report will come, TB or no TB. So prelim screening is done. But then we started going to some of the areas where connectivity is pathetic. So how to solve that? So we thought that let's build a complete AI solution in the box. It's a hardwired between the modality, which is the X-ray machine, to the AI box. So 30 seconds an X-ray is coming, 1 minute report is coming. Within 1 minute you have an X-ray and a report, screening done. Now other question is that how do you update this AI box when it is hardwired? So once in a week we used to take it to the a place where the connectivity is there, sync the latest algorithm from the cloud to this box. So more than enough. So slowly this get improved up to a higher level of screening. So AI, had it been not this basic AI in place, we could have never done so much of TB screening. This is one simple example. There are many such examples which I can go for hours and hours and hours.
No, thanks for sharing that, Rajiv. NASCOM recently made an announcement. In the globe of startups, India will have close to about 10,000 plus deep tech companies. The outline healthcare is going to be playing a very prominent role in such startups.
Yes.
So how do you envision deep tech is going to contribute to the healthcare industry?
So when we say deep tech, its simple meaning is that it is crunching huge information, which is not easily data driven, which is not easily possible with common processors. And this data is both structured, semi-structured and unstructured. Correct. So this is the prelim basis on which we are talking about deep tech. Now let's look into how healthcare would fit into the scheme of things. So machines which are there in the healthcare industry is throwing huge
amount of data.
When a patient is there in an ICU, there are multiple stuff which are
Vital
attached.
signs are read
Yeah.
and
So roughly on an average, if a patient is there, he's attached, his 6 basic vitals are getting, measured almost like less than per minute, within 30 seconds, sometimes even more than. That's why you see the continuous graph or curves. So let's assume, and this is a very conservative estimate, generally we capture 20,000 data points per patient per occupied day of the bed. So just imagine that if the patient is there for
it's a huge amount of
it's
data.
a huge amount of data. Okay, then any CT which is done will have between 200 to 500 GB, which is like almost like MB, which is like one CT, depending on the contrast, depending on its abdomen or whole body and stuff like that. But and then what's happening is that information gathering, which means this data gathering is challenging because machine is throwing data almost per second, and you can't have a human which is like looking into this and putting on a piece of paper and typing.
Okay.
So, and humans are lazy, at least engineers are super lazy.
And they're error prone, they're very highly error prone. That's the most important thing.
Yeah, it's error prone, it's mundane. So that's why IoT happened. Machines were throwing this information, it's there. Why don't machine directly throw that information into the DB directly? Because we know the structure of the machine, how it is throwing it, and we know the structure of the DB, do one-to-one mapping, and IoT was formed. So humans were lazy, mundane tasks are prone to error, as you rightly said that, and that's the only reason IoT was born. Okay, and they were in one port they were throwing the information on monitor, through other port they put the information on your DB. So one, we have huge information, and it is not humanly possible for any scientist to interpret multiple
source of data.
Some of them are directly proportional to each other, correlate to each other, some are inversely, some doesn't have a direct equation. So that typical maths, you can see only 3-4 parameters simultaneously and make sense of it. So IoT, big data will play an important role because they are already in healthcare industry for ages. So this is more of a structured information, DICOM or the images, X-ray, CT, MRI, PET CT, these are all structured information. One know that how to read a PET CT, it's a structured. Okay, they are irrespective of the type of modalities. Now what we are saying is that, can I read a chest X-ray and find out if the patient has lung cancer? Answer is yes. Was it possible earlier? Answer is no, because you need minimum CT. Well, whether each portion of the country, each small area of the country has a CT machine, answer is big no. We will have it in near future, answer is no. But chest X-ray, yes. So can I come out with a mechanism by which AI or deep tech technologies can read a chest X-ray and say that guy has a lung nodules which are very early in the stage, and at least from the screening this guy needs to go to a CT. So deep tech, next 10 years or 15 years is not of the heart, it is of the lungs. Because we are all staying in polluted cities. So lung cancer, or finding out problems by doing prelim screening tests is going to play an important role. So deep tech is definitely going to play, AI is going to play an important role. As I was explaining ICU, 20,000 data points, can I predict sepsis? If I can predict sepsis, each 1 hour early prediction can reduce the mortality rate by 14%.
14%. Absolutely.
Which is a huge, sepsis is the biggest reason for mortality in the worldwide in any hospital.
India is focusing quite heavily on manufacturing, right? Self-reliance is the theme the government of India under the leadership of Mr. Modi is currently running. But having said that, most of the medical devices, what we are using in our healthcare system, whether it's a privately held or government-run healthcare system, they're all imported, right? So do you foresee that India will also be ready for homemade medical devices?
100%. A lot of government-driven incentives, schemes are already there, and what we are realizing that young startup companies have started approaching.
For the startup ecosystem, the multi-vendor technology support probably involves about a couple of things they should keep in mind. One, keep a minimum level of inventory to client service. One client who has got multiple medical devices is something is paramount, very important for the healthcare industry. That's one. And typically, healthcare industry also demands a higher level of a turnaround time. The TAT and SLA expectation are something which is the high standard. They maintain a very high standards. I think the third and most important thing is that all these medical equipment, original equipment manufacturers, they should be willing to encourage such kind of startups, which is willing to client service.